when I first got invited, I explained that I wasn't an expert, so you shouldn't invite me, but you insisted, so here I am. So I'll tell you the story of how I ended up tweeting about COVID data in Puerto Rico, and maybe you'll find it interesting. So I'm an applied statistician. As you heard, I'm the chair of data science at Dana-Farber. My focus is analyzing genomics data, which is what I do like 98% of the time. And then the other two, I've been looking at data from Puerto Rico, as you will see today. So I have worked in several applications outside of genomics. My thesis was in analyzing musical sound. So I've analyzed many other things. I'm an applied statistician that likes working on problems. So that's how I end up, another reason I end up working on this. So what I'm gonna do in this talk, I'll try to finish in time, is first explain how I became involved in this. And what I'll try to do as a scientific message is try to convince you of the utility of visualizing data. And I think from my experience through this process, I've come to the conclusion that visualizing data in terms of monitoring the pandemic is more powerful than any kind of mathematical model in terms of monitoring it, not making predictions and decisions. And the other important point, I might not get to the details of, but the importance of systematic data organization, which in the case of Puerto Rico was and still is a big problem. So I do have several colleagues that I email and call with questions when I have them, and these are them. Mark, Caroline, and Michael from the Center of Communicable Diseases at Harvard are the experts that I consult with in this project. So this is how I got involved in this. So 3 years ago, a little bit over 3 years ago, Hurricane Maria hit Puerto Rico. It was a pretty bad hurricane. This is where I went to school. This is where I got my bachelor's degree from. It's no longer there. It's a math department. And all my family and the great majority of my friends are in Puerto Rico. So I was very concerned about the situation when this happened. So even more concerning was when the governor of Puerto Rico, about 2 or 3 weeks after the hurricane, was claiming that only 17 people had died. And this was concerning because those of us who have friends down there were hearing it was anecdotal at the time, evidence that there was many more than 17. And if the government thinks that that's all that's happening, then there's a problem. And here we're not talking about direct deaths, but indirect deaths. Deaths in hospitals and people not being able to get to get medical care. So this is when I started getting involved in data analysis related to Puerto Rico. So the colleague Caroline that I just was also a COVID expert came to me and asked me if I was as concerned as her about this fact, and I said yes. And she had this idea of trying to measure this, trying to get a better count than what was being reported by the government, and wanted me to help her design a survey and try to get at this answer. A survey because we weren't being able to get data from the government about from the death registry at the time to try to see if this was actually correct. Now, after that decision of doing a survey, we see that a preprint comes out. Somebody that did get access to the demographic data, the death excess, had in fact looked at the comparison between deaths in September and October and found that there were over 1,000 deaths over what's usual. So not 17 as was being claimed. That data you could was not available, but you could get it from some of the plots in the paper. You could extract it, and this is what it looked like. So here, there's a plot. It's very simple. It's showing you the average death rate per month based on 10 years of data, or a little bit less than 10 years of data, and then a range of deaths. And then on the blue, you see 2017. And what's the point here is that in after the hurricane, we see this this excess death that's pretty clear. So then the New York Times comes out with a similar report. This is in December. They come to the conclusion that there's about 1,000 similar, and at this time the government's saying 64. So we thought at that point that maybe we didn't have to do the survey. That was pretty clear that now that it's been pointing out that there are. Give me a second, real quick. Sorry. Give me a second. Hi, sorry about that. So at this point, we thought it's pretty clear that there is a that there is a problem, and the government by now should accept this and take action. But we see that there wasn't this is the statement from the Secretary of the Department of Public Safety, and he is claiming that this death of 500 is actually normal, because when he compared it to numbers from December and January, he sees similar numbers. So that anybody who knows anything about demography knows that this is kind of a really absurd comment, because there's more deaths in December and January than in the fall, mainly because of viruses. You can see it here. This is now based on data. You can see the difference between September and January. These are ranges of deaths in the 2 months across different years. So if you compare September to September, we see 500 extra deaths. If we compare January to January, we see 229. So at that point, when we see that government it's apparently ignoring all the evidence that this is going on, we decided to go ahead with the survey, and we continue to try to get data from the demographic registry, and we can't get it. It's a challenging. I should say that before I continue with that story, just a very quick statistical aside. All these reports, we're talking about totals and comparing totals to totals deaths. That's not necessarily what we want to do here, because you should be looking at rates anyways. But in particular in Puerto Rico, where the demographics are changing so dramatically, this is something not everybody knows, but the young population of Puerto Rico has been leaving the island for the last like 20 years, and that's what you can see here, how the population is getting older very rapidly. So it's hard to compare totals because of that. You expect more deaths now than 3 years ago, because there's more older people. Whoops, where'd it go? So yes, this is just a quick making the same point that if you compare 2016, 2011, there were more deaths 2011, but the death rate is higher. I'm sorry, the death rate is lower in that year. So back to October. So what we couldn't get data from the demographic registry, so we continue with the survey. The idea of the survey is that you go interview people and ask them, has anybody died in this household? And then you ask them when, then you compute estimates that way, you compute a death rate that way, and then you make an estimate of how many people have died based on that. So that paper came out right before hurricane season. We pushed hard for that to happen around the end of May. And the data is actually quite simple. It's the main data. There's other important information there, but one of the data related to death was quite simple. This is the deaths before the hurricane from the survey that we conducted. This is before the hurricane, and the age is on the y-axis, so you can see that it's mostly older people. But then after the hurricane, we see a lot more deaths, and we see a lot of more younger deaths. So this is the survey data. So that got reported in a paper. There's another statistical, maybe public relations aside. When this was happening, I was very concerned about the fact that there was it's a very imprecise estimate that we had based on a survey. It's very, very imprecise. And I was concerned that the media was going to focus on the one number, and I tried my best to not that to happen, but it didn't. It just got reported that way, but that did have one positive effect, and it's that it really got the attention of the government with all these papers coming out, all these news articles coming out. And then this interview from Anderson Cooper to the governor, the former governor. He's not the governor anymore. He had to resign after all this mess and other things that happened. He says that the data is public, and if the data is not public, what's that phrase he uses? Heads are gonna roll, hell to pay. So then the data becomes public right after that, and once that happens, we quickly see this is 2015 data, daily deaths. This is 2016 data, daily deaths. Here's the first part of 2017 before the hurricane. What I'm trying to point out is it looks very similar. After the hurricane, very clear that it's not normal. And this is data that they had all along, and they could have seen it to know that there was something going on. It went on way past December. So there was all these problems with the infrastructure that made it so that a lot of people died as a result of the lack of electricity, for example. So why am I telling you all this? Because this is how I get involved and get very concerned about Puerto Rico. And now this is my mindset when the pandemic hits. I'm concerned about what's going to happen now. So now I'm going to move on to that part of the talk. Let me unshare this real quick. And the reason I'm going to show you. Let me do that real quick here. Share screen. Where is it? Where did it go? I'm sorry. Where is it?
It should still be a share button.
Yeah, there it is. I got it. Yeah, so I'm going to show you, and now I'm showing you recent data. I'm going to show you data from the pandemic, and it's actually, this is called an R Markdown file, which is based on analyses that I've been doing like almost live. So I don't have it in a nice organized talk. So what you're going to see now are a series of screenshots from tweets and analyses that I did that I actually ran this morning. It gets constantly updated. So I show it that way because it's not part of my general research. It's something I'm doing on the side to try to help Puerto Rico. So here's March 11. I was very worried, in part because we know that COVID affects older people, and as I said in my previous talk, in the first part of the talk, it is an older population. This is the distribution at the bottom. This is not normal to have these many 50, 60, and 70-year-olds. That's not what the typical country or jurisdiction looks like. So there's like almost 1 million people over 60 in an island of 3 million some. And then you can see here that at the time were their death rates for those ages. Now, this is March 11. On March 15, Puerto Rico is the first American jurisdiction, as far as I know, to have a lockdown. Right on March 15, they have a lockdown, and I thought that was a good decision. But now on March 25th, this article comes out, and this is a prediction based on those mathematical models, the SIR models. And the prediction is that between 16,000 and 58,000 people are going to die. Now, just very quickly note that 58,000 people is 2% of the population. That's quite a lot in the summer. So then when this article comes out, a lot of reporters start getting concerned, and actually some of them start emailing me and asking questions about this. So that's another way I was getting involved in doing data analysis, just to help reporters understand what that was about. And one of the things I was trying to explain to them was that predictions are based on mathematical models, not statistical models or actual just data visualizations. So to give them an idea, now we can look back. Now it's hindsight. One thing you could do is you could look at up to March 9, what was going in Italy and Spain. This is how many deaths we had back then. And this was just to point out how hard it was to actually make those predictions. So then in March 25th, we have this. So from the Spain data, you can't really tell that that's what's coming next. This is what ends up happening. We don't get to those higher rates. Now we actually see Spain is up, going up again. And here's New York and Massachusetts up to March 25th. That was that day. So again, it's very hard to predict what's coming next. This is Puerto Rico at that time. There were only 2 deaths, and I can actually show you cases as well. So it was basically, I was trying to explain that those are just prediction. It's hard to make predictions, and in particular, these predictions based on these models. And one of the useful plots to show was this animation that shows what happens if you're trying to estimate an S-curve based on that small number of data points. So this is an animation. You're going to see it go as the time goes. The number of points included in the model to predict is increasing. So you're going to see this blue line move to the right. So the blue lines are the blue points are the ones used for the estimation. The black curve is the truth, and you can see that it kind of goes all over the place. You can see the prediction moving way up, way down, and it's only way at the end when you almost have all the data that it finally stabilizes. Okay, next slide. So here's what ends up happening in Massachusetts and New York. You can see the big curve in New York, and then it kind of it stopped quite dramatically after July. So so now back to Puerto Rico. We're in the summer, and we've been monitoring the situation, trying to figure out what's going on, and this is all the data we were getting. We're getting cases per day, and the problem here was that we don't know how many tests are being run. So this could be a lot, actually. It doesn't look like much. 50 cases a day isn't much back then, at least. But we didn't know how many tests were being done. And just to make the point clear that the number of cases can change dramatically depending on the number of tests. It's not rocket science. This is just comparing Saturdays, Sundays to the rest of the week. It's impossible that the virus is taking a break for the weekend. It's just that they're doing less tests. This is based on the data back then. So another example of this is a US cases. You can see it looks like there were more cases in the summer than in the spring, but that's probably not the case. Here's the number of tests being done. And you can see that when you compute the positivity rate, we do see that the peak is still in April. However, it looks like there's a second wave here, and now maybe a third one coming. You can see it kind of going up. That's the US, and you're in New York, most of you, so I want to show you New York isn't as bad. The positivity rate is still below 2.5, I think. Massachusetts, on the other hand, you can see it's kind of going up a little bit, so we're all a little bit worried here. So the problem in Puerto Rico is we can't make this plot back then. We didn't know how many tests were being run. So again, this is a Massachusetts, just as an example. I was trying to tell the Puerto Rican government, this is what you want to do. You want to be able to compute. Number one thing Massachusetts shows is positivity rate. This is, by the way, this is from July 14th. Now it's up, I think, at 5. And we couldn't do that for Puerto Rico. If you looked at the dashboards back then, July 13th, it said the positivity rate was 100, which can't be right. Here's another plot from the dashboards. Here we see the positivity rate jumping up and down. Again, it's just because they didn't have data. Here's the positivity rate at 100, supposedly. So we were trying to figure out what was going on, and it was hard to do. So one thing we could do is try to use excess stats again, like we did for Maria, like we did for the hurricane. And we actually got contacted by Nicholas Kristof around the summer, actually May, to do it for the US states. And that, I don't know how many of you saw this article, but this was based on the same code that I used for the Maria stuff we applied to the states. And then Nicholas Kristof wrote this article based on the results that we got. This is in May 13. So we're going to do this for Puerto Rico. And just to show you what it looks like, this is just to show you the type of analysis we make, just exploratory at first. This is a typical couple of years in Puerto Rico. These are now weekly deaths. Just to have less points, I turned them into weekly deaths, just for exploration. The blue curve is what we get from the models we developed for the Maria studies. And you can see that it looks like it's these 2 normal years. There's nothing going on. The weekly deaths are around what is expected. But here is Maria. You can see in red the points that are all way above what's expected. It ended up being about 3,000 extra deaths. Here is Georgia's. This is something we hadn't noticed before, at least I hadn't. This is in '99. There was a hurricane in Puerto Rico, and we also see that there's about 1,000 extra deaths that year. But for COVID, we weren't seeing it. So that was good news. We weren't really seeing excess deaths at that time. We have seen it before where a virus can, in fact, cause havoc in Puerto Rico. This is chikungunya epidemic that seems to have killed about 1,000 people. You can see all these numbers way up there. So we were putting pressure on the government to release as much data as possible and monitoring appropriately. And eventually we made a connection with this organization called the Puerto Rico Public Health Trusts. And they were able to get at least the number of tests, not from the government, but directly from the labs, the clinical labs, which there's about 6 labs that do like 90-some% of close to 100% of the tests. And we finally could compute the positivity rate. This is in late June. And we see that it actually looks pretty good. Puerto Rico's in blue, positivity rate is way down there, almost 0. So that was good news. But right after that, we start seeing this little uptick around June. And I believe that the government they stopped the lockdown around this time. And also, there was an uptick in Florida. There's 27 flights that come in from Florida to Puerto Rico, and they weren't stopping them. So again, we were very concerned, especially based on these couple of plots. Then we see that hospitalizations, we had to make this plot, we had to actually scrape data from a JPEG. That we saw that hospitalizations were also going up. Finally, around end of July, the government does share an API. They had actually, this is independent of us, they had actually started building a database, which is great. The reason they weren't sharing data was because from what I hear, the analysis was done basically in an ad hoc way where people were receiving data by email and putting it together in Excel sheets. But then at some point in the beginning of the summer, a group was hired to build a database. And they actually make an API so you can access the data automatically. And right about when they do this, we start getting data and analyzing automatically. We see that the positivity rate goes over 5%. And we build them a dashboard. I can show it to you. I'll just go real quick, show it to you. So it looks like this, and you have all, it gives us general summary. And it has data plots for all kinds of different metrics, deaths, cases, then a map by location. And this is automatic because they provide an API. It's all made day by day. So then our plots showed up in a press conference from the governor, and they put new restrictions based on the fact that now we're seeing that the positivity rate was going over 5. But then I don't know what happened. They brought in new experts. I think many of them with commercial interests, and they open again and claim that the cases are going down. And none of the data that we were looking at seemed to show that. I don't know where they got that from, but they open up again. This is in September, and now we're seeing things are getting worse again, unfortunately. So we're still fighting the fight and trying to convince them to stop listening to those experts and instead look at the data. And we're now starting to see that the excess deaths are in fact going up. This is August. We can't do September and October yet because the registry data from the registries take a while to complete. But we're not very optimistic that it's going to be great. The death rate is now up like 20% over the expected. Right. Yeah, so I'm going to end there and just leave some acknowledgements up for you to see. Thank you.
Rafael, great. Thank you very much.
Sure.
Yeah, very important government information and misinformation, as we say often. So it's clear that testing is so important, and it's hard to get the rate of testing up, but that's what we hope to do.
Yeah, right. That's definitely one of our main recommendations, in more testing. Um, but even independent of that, another recommendation, and most states are doing that. Massachusetts definitely does it. Is to monitor data and use it to make decisions. Try to make it as current as possible, as up to date as possible. So that's another thing that we recommend, that they try to improve how quick labs send data into the databases, and so we can know as quickly as possible if something's happening.
Right, because late data is not helpful in terms of handling it.
Right.
Right.
Yeah.
And the other issue I know in the States that's brought up is often the cause of death issue is not always right, or not always logged in correctly.
Right. So that's where the excess deaths helps.
Yeah.
We don't know if I don't know if this was clear, but when I show those excess deaths plots, that's all deaths. That's not just COVID. That's all of them. We just assume that anything excess now is due to the pandemic. It might not be, but it could be some weird other thing. But that's what we assume for now. So that's another thing that we're also pushing to not just Puerto Rico, but everybody to do. All other jurisdiction is it takes a long time for deaths to get registered, because they want to know exactly the cause of death. So it goes through all this long process. It takes about 45 days for it to be complete. But if you we could just if we could just record the death itself and then do all that process, we could have very, very up-to-date excess mortality estimates. Like, it would be a matter of days or less, maybe in the same day, because it's once a person dies, you can register it without cause, without knowing the cause, and you can already do these analysis. So instead of waiting what we wait now, which is 45 days to do an analysis, we could do it almost live.